Welcome. In today's session, we are going to look at the posterior aspect of the leg, and by the end of this session, you should state the cutaneous innervation of the posterior aspect of the leg, the muscles of the posterior compartment of the leg. You should know their origin, insertion, action, and innervation. Then you should know the cause of the posterior tibial artery, and we will look something with the clinical correlations. Welcome all, my name is Wallace Munyere and I'm the Ure Doctor. So, cutaneous innervation of the posterior aspect of the leg. Now, there are usually 7 nerves which usually innervate the posterior aspect of the leg. 2 are found on the medial 1/3, 2 in the middle 1/3, and 2 in the lateral 1/3, and 1 which supplies the skin of the heel. Okay, so those 2 on the middle, on the medial 1/3 are the posterior division of medial cutaneous nerve of the thigh and the branches from saphenous nerve. Remember, these 2 are cutaneous branches from the femoral nerve, with this posterior division of medial cutaneous nerve from the anterior division of femoral nerve, and the saphenous nerve is the only cutaneous branch from the posterior division of femoral nerve. And this is the area which they supply. This is the medial cutaneous nerve of the thigh, the posterior division. This is the saphenous nerve. Then in the middle, 1/3, which is supplied by the posterior femoral cutaneous nerve, or the posterior cutaneous nerve of the thigh. Okay, that one usually appears the roof of the popliteal fossa and descends to supply this area. And also you have the sural nerve. Sural nerve is a cutaneous branch from tibial nerve here, and it supplies this area. Then the other 2 supplying the lateral 1/3 are the lateral cutaneous nerve of the calf from the common peroneal nerve, supplies this area, and the sural communicating nerve, which is also from the common peroneal nerve, which will join the sural nerve some 2 inches above the heel. Okay, and it will supply this area before joining the sural nerve. Okay, and then we have the medial calcaneal branch of tibial nerve, a branch from the tibial nerve which pierces the flexor retinaculum, then curls backwards to supply this skin of the heel, supplies this area. Okay, then let's look at the posterior compartment, its boundaries and subdivision. Now, the anterior boundary of the posterior compartment is formed by the posterior surfaces of tibia, fibula, the interosseous membrane, and the posterior intermuscular septum. And the posterior boundary of the posterior compartment is formed by the deep fascia of the leg, which usually extending from the medial border of tibia to the posterior intermuscular septum. Okay, now that posterior compartment is further subdivided by 2 strong transverse fascial septa, the superficial transverse fascial septa and the deep transverse fascial septa, into 3 parts. Now it will have, the posterior compartment will have a superficial division, a middle subdivision, and a deep subdivision. Okay, now the superficial subdivision, which will be found between the superficial transverse septum and the deep fascia, will contain your gastrocnemius, soleus, and plantaris muscles. The middle part, or the middle subdivision, which is found between the superficial and the deep transverse fascial septa, will have your flexor digitorum longus medially and flexor hallucis longus laterally, and the posterior tibial nerve and vessels between the 2 muscles. Then the deep subdivision, which will be found between the deep transverse fascial septum and the posterior surface of interosseous membrane, tibia, and fibula, will contain only 1 muscle, the tibialis posterior. Let me show you that in a diagram. Here we are. So you can see this is the let me take a pen. Now this, you can see this is the posterior intermuscular septum. The one I'm drawing is the anterior boundary of the posterior compartment. Okay, you can see It is formed by the posterior surface of posterior intermuscular septum, fibula, posterior surface of interosseous membrane, and the posterior surface of tibia here. Then its posterior boundary is formed by this is the deep fascia, okay, extending all the way from the medial border of tibia to the posterior intermuscular septum. Then we will have these two transverse. This is the superficial transverse fascial septum, and this is the deep transverse fascial septum. Then here we will have the one I've marked in this. Now this from here up to here, that is the superficial subdivision. This is the middle subdivision, and this is the deep subdivision. This is the gastrocnemius muscle. Then deep to it, we have the soleus. That is the superficial subdivision. Then in the deep one, we will have flexor digitorum longus medially here. Then flexor hallucis longus laterally. Then between, we have the posterior tibial neurovasculature. Then in the deep subdivision, we have only the tibialis posterior muscle. Then these muscles are divided into two. We have superficial muscles and the deep muscles. Now the superficial muscles are the gastrocnemius, soleus, and plantaris. The deep muscles are popliteus, flexor digitorum longus, flexor hallucis longus, and your tibialis posterior. Now these two, okay, gastrocnemius has two heads, okay. Now gastrocnemius and soleus, they are called triceps surae. Triceps, 3 heads, because gastrocnemius has 2 heads. Triceps surae, and they have a common tendon known as the calcaneal tendon, the largest tendon in the body, which inserts into the middle 1/3 of the posterior surface of calcaneus. Okay, so they have a common insertion. Let's look at that. Okay, let's continue. Now, here we are. Now, we will start with the superficial gastrocnemius, 2 heads. A lateral head, which originates from the lateral surface of the lateral condyle, and the medial head, which will originate from the popliteal surface of femur and the adjoining posterior superior aspect of the medial condyle of femur. Now, in the tendon, in some people, in the tendon of origin of the lateral head, we will find a sesamoid bone known as fabera. Okay, then it is inserted into the middle 1/3 of the posterior surface of calcaneus via tendocalcaneus or the calcaneal tendon or the Achilles tendon. Okay, and it is supplied by the tibial nerve. Action: plantar flexion of the ankle when the knee is extended. Plantar flexion is that movement you perform when you are tiptoeing. Okay, then it also flexes the leg at the knee joints because it crosses both the heel and the knee joint, so it will act on 2 joints. Soleus originates from the posterior aspect of the posterior aspect of the head and the upper 1/4 of the upper quarter of the posterior surface of the shaft of fibula. Also originates from the soleal line and the middle 1/3 of the medial border of tibia, and also from the tendinous soleal arch between fibula and tibia. So its origin is somewhat horseshoe shaped. So you find this shaped like that. Here it is the posterior aspect of the head. Here is the head of fibula somewhere here, and the upper 1/4 of the posterior surface of the shaft of fibula. And here will be your soleal line. Your soleal line will be somewhere here. Okay, soleal line, and the middle 1/3 of the medial border of tibia here. Then the soleal arch will be between here. Okay, so it has a horseshoe shaped origin, and it is inserted the same via the tendocalcaneus, the middle 1/3 of the posterior surface of calcaneus, nervated by the tibial nerve, but it is by 2 branches. Now, one branch which originates from the tibial nerve, wherein the popliteal fossa separates it from its superficial surface. Then another branch which originates from the tibial nerve, where it lies on the posterior compartment of the leg, separates it from the deep aspect. So it is separated from both the superficial and the deep aspects. It is a plantar flexor. Okay, so it is the workhorse of plantar flexion. Despite any position the knee is, it will plantar flex. Remember, gastrocnemius will only plantar flex when the knee is extended. So when the knee is flexed, gastrocnemius will not plantar flex the ankle, but soleus will plantar flex the ankle despite the position of the knee. It also studies the leg on the foot during standing. Okay, so you find people with a weak soleus, when they stand, they will look somewhat shaky. Okay, and soleus, it is a multipinate muscle, and it is very strong. Okay, very strong. It operates like a bottom gear, the bottom gear of a car. Strong, but it contracts slowly. Okay, you mainly use your soleus when you are strolling. Gastrocnemius contracts quickly, but it produces a weak force. It is like the top gear of a car. So it is used by when running. You see sprinters, if you look at the posterior aspect of the leg, that you see it is very bulky. That is your gastrocnemius. Now the plantaris, you find plantaris is also known as freshman's nerve. Why? It has a very long tendon in which freshers in medical school usually confuse it with a nerve. So it is commonly known as freshman's nerve, but it is a muscle. So which originates from the lower part of the lateral supracondylar line and the oblique popliteal ligament to be inserted into the middle 1/3 of the posterior surface of calcaneus tibial nerve. It is a very weak plantar flex of the ankle. In fact, up to 10% of the people lack this muscle, but its tendon is very useful, especially in tendon grafting. We look at that later. So here we are. This is where the medial head originates from. Lateral head here, plantaris here, they all insert here. Okay. Now, here we are. Here is this is the lateral head of gastrocnemius. This is the medial head. The two of them, we have cut it to show you a soleus. Soleus lies deep to it. And here you can see the plantaris, and you can see this long tendon. So this long tendon, freshers usually confuse it with a nerve. That is why it is known as the freshman's nerve, but it is not a nerve, it is a tendon of plantaris muscle. But it is absent in up to 10% of the population. So, okay, another one to show you clearly the plantaris, its origin here from the lateral supracondylar line. Okay, then this is your soleus. You have removed the gastrocnemius. This is your oblique popliteal ligament. Okay. So same, these are your gastrocnemius here. This is your Achilles tendon or your calcaneal tendon. Okay. Then after cutting, you can see this is your soleus, plantaris muscle here. Okay, those are the superficial muscles. And remember, please remember that gastrocnemius, the two heads of the gastrocnemius and soleus, they are commonly known as triceps surae. I had forgotten to tell you something about soleus. Soleus is also known as the peripheral heart. Why? Within soleus muscle, we have a rich network of venous sinuses known as the soleal sinuses. Now, during contraction of the soleus, venous sinuses usually connect superficial veins to the deep veins. So during contraction, blood is pumped from the superficial veins to the deep veins. So it acts as a peripheral heart. Okay, please remember that. Okay, now let's look at the deep muscles, popliteus, which originates from the anterior, which originates from the anterior part of the popliteal groove on the lateral condyle of femur to insert into the middle 2/3 of the triangular area above the soleus line on the posterior surface of tibia. Okay, the popliteal surface of tibia. So how does its tendon move? Its tendon of origin is 1 inch long, and it is intracapsular but extrasynovial. So the tendon of popliteus muscle is found within the capsule, the knee capsule, but outside the synovial membrane. Intracapsular but extrasynovial. Supplied by tibial nerve. Action. It usually unlocks the locked knee by rotating the femur laterally during the initial stages of flexion of the knee. So when you are flexing the knee, it will rotate your femur laterally. Now, by rotating the femur laterally, that is unlocking the knee from a locked position. It was locked when it was extended. Now, flexor digitorum longus originates from the upper 2/3 of the medial part of the posterior surface of tibia below the soleus line, and also originates from the fascia covering tibialis posterior, or from the deep transverse fascia septa. Its tendon will cross superficial to the tendon of tibialis posterior in the lower part of the leg, and the tendon of flexor hallucis longus in the sole. And in the sole, it will divide into 4 tendons from that for the lateral 4 toes. Those four subdivisions of the tendon will insert into the plantar surface of the base of the distal phalanges of the lateral 4 toes. Innervated by tibial nerve. Action. It plantarflexes the lateral 4 toes, also plantarflexes the ankle, and usually maintain the longitudinal arches of the foot. Flexor hallucis longus originates from the lower 3/4 of the posterior surface of the shaft of fibula behind the medial crest, and from the adjoining part of the posterior interosseous membrane. Its tendon will groove 2 bones, tarsal, between its medial and the posterior tubercles, and the calcaneum underneath the sustentaculum tali. Now, in the sole, it is closed superficially by the tendon of flexor digitorum longus, and it inserts into the plantar surface of the base of the distal phalanx of the great toe, the harax. Innervated by tibial nerve, plantarflexes the great toe, plantarflexes the ankle, but weakly. Also supports the medial longitudinal arch of the foot only, does not support the lateral longitudinal arch. Tibialis posterior. Now, tibialis posterior originates from the upper 2/3 of the lateral part of the posterior surface of tibia below the soleus line, also from the posterior surface of fibula in front of the medial crest, and from the upper 2/3 of the posterior surface of the interosseous membrane. Its tendon is closed superficially by the tendon of flexor digitorum longus in the lower part of the leg, grooves the back of the medial malleolus, passes deep to flexor retinaculum, and superficial to the deltoid ligament. It will insert chiefly into the tuberosity of the navicular bone, but it has slips that pass to all tarsals except talus and the bases of second to fourth metatarsal. Okay. Innervated by tibial nerve, it actions foot inversion, maintains the medial and longitudinal arches of foot. So we have a medial arch and a longitudinal arch of the foot. It maintains both. So, okay, let's see if you can. Okay, here we are. First, identify which is the lateral side. This is, you can see this is a fibula, so this is lateral. So this is your popliteus here. Okay. Now, since this is the medial side, this must be a flexor, digitorum longus. Then this will be a flexor, hallucis longus, and this is your tibialis posterior. You can see it is covered by some fascia, the deep transverse fasciosepta. Okay, you can see the origin and insertion. Popliteus originates here. The popliteal groove to insert here. The soleus line is somewhere here. Then here you can see the origin of, since this is the medial side, this is the flexor digitorum longus. Then tibialis posterior will originate here. Then your flexor hallucis longus will originate here. Okay, and you can see its tendon will insert into the distal phalanx of the great toe. Okay, then you can see the tendon of, this is the tendon of, the in red is the tendon of tibialis posterior. Okay, and this is the tendon of flexor digitorum longus inserting into the distal phalanx of the lateral foretoes. Okay, the same here. This is just the same. Okay, just maybe to note this is a flexor now hallucis. Now, posterior tibial artery. It is the larger terminal branch of the popliteal artery. It begins at the lower border of popliteus between tibia and fibula, deep to gastrocnemius, and enters the back of the leg by passing deep to the tendinous arch of soleus or the soleal arch. In the leg, it runs downwards and slightly medially to reach the posteromedial side of the ankle, where it lies midway between the medial malleolus and the medial tubercle of calcaneus. It terminates deep to the flexor retinaculum by dividing into a larger plantar artery and a smaller medial plantar artery. Its main branch is the peroneal artery, which supplies the muscles of the peroneal compartment, namely peroneus longus and peroneus brevis. It also has muscular branches to the muscles of the posterior compartment, the nutrient artery to tibia, which is the largest nutrient artery in the body, the circumflex fibula artery, which encircles the lateral side of the neck of fibula and participates in the genicular anastomosis, communicating branch, which joins with the similar branch of the peroneal artery, medial malleolar branch, which passes towards the medial malleolus and participates in the malleolar anastomosis, the anastomosis around the ankle. Calcaneal branch pierces the flexor retinaculum and supplies the soft tissue of the heel. Terminal branches are the medial and the lateral plantar arteries. So here we are. This is your popliteal artery. Then here you can see this artery which is running with a nerve. This is the posterior tibial artery and the tibial nerve. This is your peroneal artery. You can see here. Here you can see it is closing the soleal arch. Okay, when the popliteal artery closes the soleal arch, it gives off a branch, the anterior tibial artery, which will pierce which will pass through a gap above the interosseous membrane, and this common trunk here will divide into posterior popliteal artery and the posterior tibial artery and the peroneal artery. Okay, then you find some text which called this part before the artery bifurcates as the tibial fibular trunk. You might find some calling it like that, but okay. Then the tarsal tunnel. The tarsal tunnel is an osteofibrous tunnel which lies behind the medial malleolus here, and it is usually roofed by the flexor retinaculum. Okay, now There are structures which pass through the tarsal tunnel. You should know how they are arranged from lateral to medial or medial to lateral. This is a potential question, and the examiners like it. So the most medial is the tendon of tibialis posterior, followed by the tendon of flexor. This is the tendon of tibialis posterior here. Then followed by the tendon of flexor digitorum longus, then the posterior tibial artery, then the nerve. We start with the artery, then the nerve, then the last one is the tendon of flexor hallucis longus. So you should know that arrangement. And here we are. This is the flexor retinaculum here. We have a mnemonic from medial. This is medial to lateral. Okay, this is medial, this is lateral. The mnemonic is the doctors are not here. T for the tendon of tibialis posterior, D for flexor digitorum longus, A for the posterior tibial artery, then the tibial nerve, then the flexor hallucis longus. You should know that arrangement. Okay, they like that question. Now let's look at some clinical correlation. We have the posterior tibial pulse, which can be felt against the calcaneum about 2 centimeters below and behind the medial malleolus in front of the medial border of tendocalcaneus. Now, since the posterior tibial artery lies deep to the flexor retinaculum, you must ask the patient to invert his or her foot to relax the flexor retinaculum, and failure to do so may lead to an erroneous conclusion that the pulse is absent. So you must relax this flexor retinaculum so as to feed the artery. And how will you relax? Ask the patient to invert his or her foot. Then you have tendon grafting. Now, plantaris is a vestigial muscle in human beings, and it is absent in 5 to 10% of the people. It has an insignificant role either as a flexor of the knee or plantar flexor of the ankle. Hence, the tendon of plantaris is used in grafting. So you might find some people who need reconstructive surgery of the tendons of the hand, and the surgeons will extract that tendon of plantaris, and they will graft it into the hand. Okay. Then there is also another clinical correlation, which is known as tennis leg. I've forgotten to indicate here, but tennis leg is caused by overstretching of the medial head of gastrocnemius, especially in tennis players who overstretch their legs. So when the medial head of gastrocnemius is overstretched, the patient will present with a very painful cough, okay, due to overstretching. So thank you for your attention, and please subscribe for more anatomy and biochemistry content. Thank you.